What if your back pain isn't actually from your back? I'm Dr. Paul Fisher with Innovative Nerve and Joint Center's chiropractor. And over the decade and a half or so in practice we've seen almost every kind of back pain you could think of, from disc herniations to spondylolisthesis to muscle imbalances to leg length inequalities to failed back surgeries. We've seen it all. But one thing that many people don't realize can be causing their back pain is their hips. Now, that's not to say the back doesn't hurt, but sometimes what you have is pain in one area because of problem in another. And your hip should have a certain range of motion. These beautiful books of light reading, AMA Guides to Permanent Impairment and AMA Guides to the Practical Range of Motion Assessment, give us what should be roughly normal ranges of motion. Now, your low back isn't supposed to actually rotate that much. When they talk about doing the rotation on here for your mid back and low back together, because you can't really separate them, it should be 35 between both, and then they pull out 5 degrees for the low back. So it's really 30 degrees in your upper back and then only 5 in the low back. You should actually be rotating more through there when you go through there. And actually, lack of rotation and extension in there has a lot to do with shoulder pain. We'll talk about that in another video. But really what's important is the rotation from your hips. Now, as you see here, when I'm trying to rotate like this, my hips aren't moving at all. Now, there should be a rotation where they're going back and forth like that. You should be getting the vast majority of that rotation coming from your hips, not from your low back. Now, because of a sedentary position or previous traumas or a whole host of other things, your hips can get locked up. And we see problems with this with a lot of patients who try to do like rotation sports, golf being a big example, tennis, pickleball, stuff like that, is at the end of it, their back is killing them. It's because all that rotation is going through their back as opposed to through their hips like it's supposed to be. Now that the way that the hips are supposed to rotate is, if you watch this video, you bring one knee up and then have it go forward. It should be roughly 40 degrees going internal when you rotate like that, and 45 going to external. Now, that's the ideal. Really what we want to make sure too is that they are rotating freely and that they're symmetric side to side. If we see a lack in one of them, we can almost guarantee that there's a problem going on with the hips that needs to be addressed. So your back pain, while I don't doubt that it may hurt, the problem may actually be just a little bit lower in your hips. And that's why that's always one of the things we check for all of our patients with low back pain. Now, here's a couple of exercises that you can do at home that are really easy to do and you don't need a lot of equipment. Just be careful while you're doing them. One is just taking a foam roller and just rolling it on your hips like so. Simple, easy. You can get these off of Amazon for about $20 now. Do that for about a minute once or twice a day. Another one, and this is really to encourage rotation in the hip, is you're just going to stand on one leg and try to lean forward a little bit so that it's going through your hip, and just open and close and go back and forth that, and really focus that all that rotation is coming in through that hip, and just back and forth, back and forth. Normally 2 sets of 15 every day. It's a good way to start waking up some of those muscles and encourage that flexibility. If you're still having back pain or have a few other issues going on because of that, please message us, reach out below. We'd love to see if we can help. Like I said, this is something we see all the time. Again, I'm Dr. Paul Fisher with Innovative Nerve and Joint Center. Love to see if we can help.